Hi everyone, my name is Monica, and today we are going to be talking about another criteria for OET writing, and that is going to be content. So first of all, let's understand what do I actually mean by this word content. What I mean by this word content is the fact that all the information that the reader needs to look after the patient that you're referring to the reader, that is what we call content. So all of the relevant information, all the important information, why is it important? Because that information is absolutely required by the reader so that he or she can look after your patient. So that is basically what we mean by content in very simple terms. So where can we find this particular information? Well, if we talk about this content, where we can find it is in the case notes. We are not going to find it anywhere else, right? But you have to keep in mind that all of the information which is provided in your case notes does not actually mean that all the information is going to be considered under the content section. No, content would have to be dealing with relevant information for the reader of the letter, right? So all the information there is actually not relevant. You will have to carefully select the information from the case notes, deciding whether or not this information is required by the reader. And what can help you decide which information to select to write in your letter? Well, there are a couple of things that you can do. First of all, the one thing that you can do is that you want to ask yourself, is there already a professional relationship between the reader of the letter and the patient in the letter, right? For example, if the reader already knows the patient, then you will certainly leave out information about the social background of the patient, because the patient's, I would say, any kind of healthcare professional would already have that information, right? So the left out information is going to be something which you will decide whether out of all of that information, which information is absolutely necessary for the reader to know so that the reader can look after your patient, right? So that's the question that you want to answer if you are choosing to select some information to write in your letter. Now, let's look at this particular case note here, where it says that a hospital occupational therapist, just a general hospital occupational therapist, writes a letter discharging patient Jack Spencer to the occupational therapist at the care center where he will receive rehabilitation. So we are writing to an occupational therapist. And the questions that I want to ask myself, again, the two questions: is there a professional relationship between the two? What I see is there is no professional relationship between the two. So I will have to present the information as brand new, right? So in addition to that, what I want to see here is that because the occupational therapist is going to look after the patient so that the patient can receive rehabilitation care. So in order to provide the rehabilitation care, I will have to tell the occupational therapist what is the current ability of the patient. What tasks can he do currently, what tasks he is not able to do currently. I may not have all the information from my case notes, right? But all of this information is going to be sufficient for the occupational therapist in order to provide rehabilitative care to the patient here. Right. Now, another thing that I decide here is that even though brand new information about the patient's children, the job prior to their retirement, and grandchildren, and maybe the financial status, as you can see here, will also be given. This is also going to be brand new information, but I am not going to write this in the letter. Why? Because all of this information is not needed by the occupational therapist, by the reader of this letter, to look after the patient, to provide the rehabilitation care to the patient. So that is how you select relevant information for the reader of a particular letter, right? So keeping the reader in mind is the key here. Now, let me change the case notes a little bit, just to show you the difference between selecting information here, right? So if I was writing, if the occupational therapist is writing a letter to the patient's regular GP, regular general practitioner, what it means is that the patient already knows the GP. right? And the GP already knows the patient. If that is the case, then that means the GP would already have information about their background, anything regarding their past medical history, anything about their social history. He would already have that information. So that means I should not write this information in my letter, right? Now, what I should write is the information that the GP will require to look after the patient, right? So I will definitely write information about the patient's abilities and inabilities, but I will alter them a little bit. That doesn't mean that I will write information from my own end. No, I cannot write information from my end. I only have to choose information from what is given to me in the case notes. But what I mean by this is that I will update the GP that, see, since the last time you saw the patient, this is something that has happened. This is how the abilities of your patient have changed, if they have changed, right? So this is how I will present this information, not as brand new information. So how you present your information in your letter matters a lot. Okay, so that is another thing. Now, the reader and the patient, because they already have, so we have already covered this point, right? So we will not be including anything about the social history. So basically what I mean is that if you want to get high marks in your content selection and selecting the relevant information, please make sure that you are selecting information on the basis of who the reader is, if there is any kind of existing relationship between the reader and the patient, if what kind of information is required by the reader in order to look after the patient, in order to care for the patient, right? So when you do that, if by the end of the letter, if you have written a good letter, then by the end of the letter, the reader would have a very clear understanding of the current situation. What is the patient's situation, right? What kind of problems he is facing, what kind of issues are there to be dealt with. And the reader should not have any more questions about the patient or about the kind of care. Basically, he should not have any questions, because you have provided all the necessary information which is required by the reader in order to actually look after your patient. So that is how you decide. So if after reading your letter, let's say if somebody else is reading your letter and they don't understand why you have asked the reader to do certain kind of task, then that means you should explain why you're asking them to do a particular task. If the information in your letter does not really explain how this something happened, so that is also another thing that you should keep in mind. So I hope you found this particular video helpful in understanding content selection a little bit. And that's going to be it for the video today. Thank you for watching.